My name is Dr. Roona Ray. I'm a family physician. I I live in New York City. I trained at the University of Massachusetts in Worcester, Massachusetts for medical school. Um, and I came to New York in 2010 for residency. I did residency in family and social medicine at Montefiore Medical Center. Um, and there I was actually part of a resident union organizing drive with CIR, the Council of Interns and Residents, which is an SEIU branch. Um, and that was actually a failed organizing drive, but it was a good learning experience. Previous to medical school, I had experience organizing um, with low wage workers. Um, so like janitors, security guards, dining hall workers when I was an undergrad. So I had some background in kind of labor issues and solidarity. I didn't, I was pleasantly surprised to see that there was a union organizing effort when I was a resident. I hadn't really anticipated that, but I was glad to see it. Um, I learned a lot from that failed organizing drive. I learned that in organizing, you really have to create a lot of relationships with your coworkers and not rely on union staff for all the information. Obviously they can be very supportive and have a lot of information, but there's a saying, the union is you, and the union really is. It can be anything, any kind of organization you want it to be. And ideally, it's an organization of coworkers who support each other in, their needs and their goals. Um, there's a lot of, in America in general, there's a lot of negative stereotypes of unions. And I'm glad that you asked everyone to introduce themselves and explain their experience with unions, because often what people hear about unions is either from the news or from movies or from their family members. And so people with family members in unions tend to have a more positive view of unions. And those without family members in unions often don't know much or might have more negative views. Um, uh, so, a union basically is a legally protected body for people to act collectively in their workplace to make things better, however they define it. Ideally, it's democratic. That means it involves as many people as possible, listens to their thoughts, and has some method by which to integrate all their ideas. Often unions don't necessarily work this way, but I think the goal for many of us in unions is to have open, participatory, democratic organizations that help create, change, positive change in the workplace, however it's defined. Um, After residency, I went to work at a community health center, federally qualified health center called Callan Lord Community Health Center. It's an LGBT focused health center in New York City. And about maybe 6 months, I think, into working there, I heard that there was a union organizing drive. And I was, again, pleasantly surprised. I got involved in that. After about, I don't remember, maybe 6 months or so, we did win a union with a lot of pushback from the management of our organization. They hired a very famous, very expensive anti-union law firm called Jackson Lewis for their strategy to defeat us, but they lost. And I was part of the bargaining committee that took about a year and a half, I think, to win a first contract, negotiate and win a first contract. That was a great experience. I saw how you can really, get a lot of people involved, diverse perspectives and experiences in the workplace to create a pretty good contract. And I also had pretty good experiences there with union staff who really helped create a good process for having done that. That union was through SEIU 1199, which is a big union that represents a lot of healthcare workers in New York and up and down the East Coast. It's important to know that we did win a union contract there, but I've heard of statistics. I don't have a citation for this, but I've heard that 50% of people who are workplaces that win unions never get a contract. So, once you win the union, it's also very important to continue organizing and, win a contract. So it's a long haul, but I think I really appreciate what Matt said. I think there's in this increasingly corporate healthcare work world, it's important for doctors who have their patients views, I think, at heart and other healthcare workers to organize. I left that job in, I think, 2016 or so. And I later worked in a non-union job, and then I came to my most recent job, which was for the city hospital system in New York City Health and Hospitals, where I had a union that had been established for several decades, Doctors Council, as Matt mentioned. And they, at Health and Hospitals, Doctors Council didn't really have any like meetings. There wasn't really much opportunity to participate in any democratic fashion. I was involved a little bit in our most recent contract campaign, which concluded just a few months ago. It was about a year and a half of negotiating. I would say it was not a model democratic experience, and ultimately the contract we got, I think, disappointed a lot of people, and there was a very flawed process at the end for, getting its passage, its acceptance from the membership. So I think it's been instructive but disappointing to experience this. It's interesting that Matt and I are both in Doctors Council but have had very different experiences. I actually was laid off from that job when I was 9 months pregnant. And the union has been very unsupportive in supporting my case personally. And so, those have been my main experiences with unionizing and doctors' unions in particular. I am still very pro doctors' unions for all the reasons Matt said. I think we need doctors and patients to organize, to know each other, to trust each other, to advocate for better healthcare, public health in our health systems and in our communities. And I'd be happy to take questions. Thanks.
Thank you for sharing your perspective, and we can get into it later if you feel free to, or like you have the opportunity to address it right now. So it seems with your second experience, it was a bit more negative, or maybe the union didn't have as much power. Is that a common experience? Like a union will have a lot of, excitement around it, and then it'll kind of fizzle out, or would you say that's more of an exception? Sorry, you're muted, Dr. Ray.
Oh, sorry. Thanks. So I mean, I think it's very variable, a union is just like any other institution in society, like a PTA or a city council. There's, as many variations as there are people within the organization. I think a good union that continues its momentum and, oh my God, I'm sorry if you can hear my kids. A good union is one that, has regular meetings, social relationships, between its members, and can maintain like conversation and momentum. Yeah, so I think that that's really where it starts, having strong relationships, among coworkers, trusting ones where people feel like there's shared interests, and they can talk to each other about their concerns, whether they're personal concerns or their workplace concerns more generally. Yeah, so I can't really generalize. I did, the time when we unionized at Cal and Lord, we, we, there was about 3 other unions in about a 2-year range that I'm aware of on the East Coast in different community health centers that that unionized, and they all had slightly different experiences. But I think overall the general gist was that health workers wanted a say in their workplace, one that was protected, where they didn't have to feel like they were going to be retaliated against for speaking up for their patients' needs. Even just basic things like, scheduling, having access to, making changes in their schedules when they need to for patient care, that kind of thing. Yeah.
And then I'll open the floor up to anyone who has a question for Dr. Ray before they have to leave. Okay.
I have a question. Sorry, Zachary.
Yeah, no worries.
Thanks so much for being here today. Um, I was wondering, like, when you're starting to form a union, you said that obviously there are some like basic things you all share in terms of changes you want to see in the workplace. Do you guys also take part in advocating together at things at the state or national level in terms of healthcare policy?
I think you totally can. And I mean, in my opinion, I think that, that's something that an important reason to be in a union, and something that you would want to do with your union to, I think a lot of us go into healthcare because we want a better world, we want a better public health system. However, we define that, there's so many different iterations of that. And having an organized voice as healthcare workers is very powerful, and doing whatever kind of activism as a group is a really, it's like a powerful use of organized labor. Whether it's lobbying at the state or federal level or at the city level, whether it's being at local protests, being an activist in the streets, however you want to define it, however your group wants to take action together. I think a union gives people the place to do it. And in terms of like forming a union, people often wonder, well, how do you do that? Is it like, it might seem like sort of a complicated process or very distant, hard to understand, but it just starts with basic conversations, one-on-one conversations with your coworkers. You start with the people you know and have good relationships with, and you just ask like, so what do you like about your job? What would you want to continue in your job? And what do you want to see change? Do you feel like you have a way you could make the changes you want to see? What do and then you have that conversation. And when you feel like, you and the other person are ready, you ask like, have you heard of unions? What do you think about having a union in this workplace? What would that look like for you? And see how they react. And you don't necessarily have to have all the answers for what it's going to look like. You can say like, I'm trying to figure this out too, and maybe we can like do some research together, or ask other people who are in unions, look online. At the beginning, when you start talking about unionizing, you want to make sure that you keep it secret. So you want to talk to people that you have good relationships with, and you feel like, you can say this is a conversation in confidence. And the reason for that is because you don't want the employer, any boss, to find out, because when they do, they will start a campaign, an anti-union campaign. Um, so if you want to have those conversations, exploratory conversations, it's good to have them ideally not at the workplace, privately. When I was doing it at Callan Lord, we had a coworker who lived kind of close by, so she was very generous and invited people over to her home, and and that was like a nice setting because it was comfortable and people felt, like safe. There was no time limit. Um, yeah, so practical questions.
Yeah, I want to just pop in real quick and say, like, yes, you can advocate. We have done that. We have like joined political campaigns with other unions as well to go to our state. Um, and I would say real quickly, like that as a union, your power is in collective action, is working collectively. Like we're not exactly like a lobbyist group, but we do get involved in political action, certainly. But it's like our main power as a union is collective action, like direct action, I would say.
Okay. And then I'll just open the floor for questions one more time. And then if not, um, we'll go ahead and move on to Dr. Archbold. And before we move on, I do want to thank you for taking time. It seems like you're very busy, Dr. Ray. So the fact that you took time to speak with us, we really, really appreciate it.
Yeah, of course. Thank you so much for inviting me. And if people have any questions they want to reach out, you're welcome to. My email is roonaray@gmail.com. You can also distribute it, and follow up information. Thanks again.
Thank you.
Bye.
Bye-bye. Right. The floor is yours.
Yeah, thanks, Zach, for facilitating and for Marvin for inviting me. It's a real pleasure to meet all of you. I hope that we can stay in touch and just like Roona said, please feel free to reach out to me to continue the conversation about organizing. I'm Damien. I'm a doctor at Elmhurst Hospital in Queens, New York City. I'm an anesthesiologist. And I grew up in a single parent household. My mom was a ICU nurse, and she was involved with organizing her workplace in California with California Nurses Association. And so I grew up hating going to meetings because that was a childcare, going to union meetings. So I was involved in that world for a while as a kid. I moved to New Zealand when I was 13. And in New Zealand, the residents and the attending physicians are in unions. And it was just a normal arrangement that we would periodically go on strike. So the first few weeks of my internship year, we went on strike over limits that management was trying to place on the free food that resident physicians could claim. It seemed a little bit ridiculous to me at the time, but it's made more sense to me as years have gone by. The not giving an inch and having a militant fighting doctors union as a way to balance Zach, you used the word power. And that's such an important concept that I think doesn't usually make up much of a part of your medical education, is your power to stand up for yourself and your patients. There's a real power differential in the United States in general between working people and employers that has degraded and gotten worse since the high point of organized labor in the 40s. And that's been a really, like, it's so important to perceive the deindustrialization, the privatization, deregulation in the United States with the decline of unions and organized labor, with the growing wealth inequality and what we're seeing now, the authoritarianism. And I'm really hopeful that especially the people on this call who are future leaders and people who believe in public health care can leverage the power of organized physicians who still have a lot of moral credibility in society, but are also strategically important workers to push back against authoritarianism, to promote democracy, and also to build a better health system. But what we have at the moment is an increasingly powerless set of employed physicians. Dr. Roona Ray has a very good presentation where she has a graph showing that doctors went from being private practitioners, their own bosses, to being employed. Almost 80% of doctors across the United States are employees, whereas 10 years ago they were mostly in private practice. So we're employees of, like Dr. Hoffman described, multi-billion-dollar corporations that are merging and acquiring each other rapidly, that are vertically integrating, purchasing pharmacies. They're becoming payviders, so they're insurance companies and giant health systems who also own the billing companies and also own PBMs. So these groups are amassing wealth, they're becoming monopolies, and their political power is growing in an unprecedented way that pits the individual doctor in an impossibly powerless position to stand up for themselves or their patients. And you'll experience that on the wards. You'll feel that you're being pressured to speed up, to cut corners, and to not stand up for your patients when you see them being mistreated by a system that is designed to extract wealth from sick and injured people rather than take good care of them. But doctors hold a unique position in that all coding and billing relies on us to click boxes in, what you've all experienced is an increasingly esoteric, frustrating electronic health record. And these giant providers, so health systems and payers, the health insurance companies, rely on us attesting and signing patient records so that they can be coded and billed. So I think there's a huge amount of potential if doctors can get better organized to, on a mass scale, do what the Allina docs and what Dr. Hoffman described is bargaining for the common good. So unionized, organized physicians can stand up for themselves and make sure they get paid well and have good benefits. I think that's just an obvious baseline. Every worker deserves to be paid fairly and have a retirement benefit, and if they get sick, they have health insurance, etc. I think that's a no-brainer, but I think doctors are unique in our ability to bargain for the common good. And the example of shaming and ending a policy that fired patients when they were in medical debt being the leading cause of bankruptcy in the United States, that's a really tantalizing example of the sort of policies that organized physicians can enact and win back from these corporate employers. So getting organized is a way to build power, and that's a really important concept, that you can have a unionized workplace that is disorganized. And so what Dr. Ray was describing, the way that she was retaliated against by her employer when she was 37 weeks pregnant, that reflects an inability of her coworkers to act on her behalf to pressure the employer. Whether you pay union dues or not, you can be organized. So, for example, if you are a new intern and one of your coworkers is unfairly disciplined, you have the power to connect with each one of your coworkers, have one-on-one conversations, have a list of their phone numbers, decide to meet and discuss how you will collectively act to respond to that discipline. And this is something that workers have been doing for 100 years. And the reason that we have a 40-hour work week and a weekend and that there's not child labor is because of organized workers responding to extractive, harmful practices by their employers. So I think there's a lot of potential for doctors. I think the current incarnations of the doctors' unions in the United States are pretty flawed. I think they have been compromised by sort of corporate practices and business unionism. But I also think it's changing, and I think especially Matt Hoffman's group has a lot of potential for pushing back on that process and reorienting us more towards policies like the New York Health Act or Medicare for All, or pushing back on the corporate practice of medicine in various ways that organized doctors have so much potential and power to do if we get organized, but first understanding the headwinds in front of us. I was on the bargaining committee of my hospital trying to bargain for a contract. It was a very frustrating and ultimately basically failed process. But it was a learning experience, and it put me in contact with a lot of interesting people. I would love to hear from you and answer any questions or hear your thoughts.
I will open the floor up to questions, but I see Marisa, if you would like to introduce yourself or say something very quickly as well.
Sure. Hi guys, thank you for having me. My name is Marisa Powell and I work for Doctors Council. I've been organizing with doctors since 2018 or 19. And then before that, I was briefly at a civil rights law firm. I also worked for the National Treasury Employees Union representing federal sector workers. Just really different actually than healthcare unions and in the private sector, but there were still some cool things we did there. Like it was during that experience that Trump was doing his first round of union busting with executive orders, making it really difficult for federal sector workers to organize on the job, to spend official time doing union representation work and things like that. And so I was a part of the legal team that argued that it was unlawful and unconstitutional to make those executive orders, and Justice Ketanji Brown Jackson agreed with us. And anyway, that's how that played out. It was great. In the private sector and with doctors in particular, I think there's so much power here. It's novel in certain ways. Like I feel like every time we go through an organizing drive, people are so excited to hear about it. It's usually like the first of its kind in the state. It's the biggest of its kind in the state because it's like a very, you have really small likelihood that most private sector organizations have even contemplated unionizing before. So I think there's still a certain amount of novelty there. But it's also something that's been going on for a really long time. Like Doctors Council and a bunch of the doctors unions that currently exist have been organizing since like the 60s and the 70s, and other healthcare workers, decades before that. So I think now we're in this moment where people are reaching out all the time and trying to figure out what is possible, what sort of changes can you make it work. And I think it's really important to keep kind of pushing forward and organizing in this current moment. On that topic of like organizing and negotiating and bargaining for the common good, there's this group in Ohio that I've spent time with over the last year. And one of the things that they did is they sort of got their colleagues ready to move forward and garner more support to unionize, is they did a series of issue-based campaigns, knowing that maybe people would be scared to talk about unionizing right away, and it is scary. And especially in this current moment, employers are way more brazen about retaliating, knowing that like there's very little that anyone can do except for organize to push back. But anyway, like one of the things that happened was the employer made an announcement that they would be outsourcing all of their labs to Quest. The same thing happened actually with Matt's group at Allina in Minnesota. What that meant was that like labs would be sent across state lines every single day. They would be storing labs in Pittsburgh when these people were in Cleveland, which like they're not super far, but it also doesn't make as much sense as doing labs in-house. And I think the doctors viewed it as a quick cash grab, a quick way to make a bunch of money in the short term, knowing that people would have huge delays and possibly medical errors as a result of this change. And so they organized around it. They did petitions. They actually were on the employer's case so much that they agreed to sort of establish a leadership team of physicians, not really a leadership team, but like physician leaders who were trying to unionize, talking with the chief medical officer. And every single time there would be an issue with one of the labs, they would forward that issue to the CMO and say like, do something about it. And that was the mechanism that they ended up creating through organizing and through the petition to try to make a difference in real time with the labs while they continue to organize for their union. So I actually do think it's really possible to, even without a union, try to make changes. I definitely think it's possible to organize and use your power of being organized physicians on a broader level, like on a state level or on a national level, to try to lobby or advocate for something better. And I appreciate Damien put in the chat the information about their petition, their website. So 2 of the leaders of that effort that I was mentioning were recently fired for unionizing. I think that like it's not without risk. Employers don't want to see you succeed. When you're trying to organize, they know that there's a ton of power and they would rather take their chances of doing something wrong and doing something illegal than allow movements to move forward in earnest. I think that that's the calculated risk that they take every time they hear about people trying to organize a union. And so they fired 2 of the leaders, and they're organizing really, really hard right now. We were just doing an informational picket on Friday, which got a ton of attention and support. I guess the long story short is this, like, I think that this is a hard environment to organize in right now, but I think it's one that people have to try to organize anyway. There's no other way. You have to talk to your colleagues and you have to be brave and you have to lean on each other, and that's it, especially as, you know, kind of at a national level, especially, things get worse and worse by the minute. So your power is each other.
Yeah. Thank you for sharing that, Marissa. And then Dr. Malik, it seems like you have a question. Ask away.
Yeah, I would like the students to take priority over me if any of the interns have a question. But I got a couple big questions unrelated to each other. So I'll ask the smaller of the two first. So there are other physician organizations that exist. Every hospital has a medical staff organization. And this theoretically is very separate from the vertical hierarchy in the hospital. So in other words, if you're paid by a hospital as a salaried employee, I call that the vertical hierarchy. You're an employee, just like the nurses, just like the maintenance staff. But there's a completely different hierarchy where if you put in a physician order for hydrochlorothiazide for a specific patient at a specific time, it's supposed to get done. And the CEO of the hospital has no power to get rid of your order, to modify the hydrochlorothiazide. In other words, that's a hierarchy at which physicians appear to be at the top, and hence some of the power. And I think I can't remember whether it's Matt who talked about the billing part of it, or Damien maybe, that it gives you a certain power when you're writing the bill, in addition to writing the nursing plan. So, but anyway, as part of this other hierarchy, at which physicians are sort of at the top, you're supposed to organize as a medical staff. And that's a different organization. You pay your dues to the medical staff. The hospital is not supposed to theoretically be involved. This is a way for physicians to express themselves. But you folks have joined a union, and obviously you don't think that's enough. So that's one potential alternative. And the other one is the state medical society. So I'm in Vermont. We have a Vermont Medical Society. It's kind of active. I can tell you one of the several reasons it's not likely to do much, but it's kind of dominated by the university hospital, and people apparently don't want to get threatened by the management there, so they kind of never speak out against it, even when they're unhappy. That's a whole nother thing. And maybe it's not a whole nother thing. Maybe it is the thing. But the idea is there are these other organizations, the state or county medical societies, which as part of their own thing, ultimately that's part of the AMA. And then there's medical staffs at each hospital. So those are two potential alternatives to organizing. And I just like to hear comments from our guests about why it needs to be a union, because unions have pejorative implications. They used to, at least. They may not anymore. But any comments on that? That's my smaller question, by the way.
I have a comment on the medical staff organization side of things, because the primary care physicians at Mass General Brigham actually organized despite having historically a really strong medical staff organization, like the MGPO and the BGPO is what they were called. And I think that this is a testament to the corporatization of medicine. For them, like for decades, they had these really, really strong internal hierarchies, these really strong organizations. They said that that almost operated like a union. It would have been stronger than their perception of a union. But for them, within the last year, they basically made the organization made the head of that entity the same as the CMO. And so there was a conflict of interest, right? And so they said, no longer can we expect this organization internally to advocate for us anymore. There's this huge conflict of interest here. We have to do it ourselves. And they're not the only group that I've heard that happen with. And so I think that you're right. And I think that these are all things that can exist and build a lot of power when they're working really well. But I think that corporate greed makes it really difficult for these things to work really well right now. I don't necessarily think that it has to be a union. I think that all you need to do is organize, however you do it, and make sure that whoever is organizing, that it's the workers that are centered. It doesn't have to be a union. It could be a really strong physician group, but only if there's no conflict of interest.
I mean, my attitude on this is that, I mean, I'm just going to be honest, you know, if medical staffs and professional societies were going to help, they would have helped us by now, but things are getting worse. Things are getting more corporate. There's been more corporate consolidation, even within nonprofits. Nonprofits are selling pieces of their business to Quest. Medical staffs have not been able to stop this. You know, professional societies have not been able to stop this. I believe the reason that is because they don't have the leverage that a union does. I mean, a union has real leverage where they can withhold labor to stop these things. And I'm not saying it's like for lack of trying or bad intentions of anybody. Like, I think medical staffs, professional societies are great. But frankly, I don't think it's enough. And as Marisa said, you know, within professional societies and medical staffs, a lot of times there's huge representation for people that are in management, doctors that are in management. That are they doctors? Yes, but they serve in managerial roles. They serve in roles where they are often acting against the interests of workers and often, honestly, against the interests of patients. And so, you know, a union is not management. A union is by definition workers. It's by definition rank and file workers. These are the people that are working day to day in the exam rooms with patients that really know what patients need. And I don't think there's a replacement for those people to work together and really have the leverage to push for change. So I just don't think it's something that we can count on these other groups to do alone. I think that unions serve a unique role. And as Damien mentioned, I mean, in the history of when we look at the history of labor and the history of labor laws, you know, why we don't have children working, why we don't have people working, you know, on weekends in many industries or unsafe hours, working unsafe overtime. I mean, because it's of unions. Unions have been able to push these changes, and I believe the same thing is true with workers in medicine.
Yeah, and I'd agree with a lot of the sentiments. It's something I think a lot about also, these parallel structures of kind of for clinical governance within hospitals and clinics do exist. But as everyone else has said, as medicine is corporatized and these giant nonprofits and private equity groups, they have compromised those hierarchical structures. And they're no longer comprised of rank and file doctors who are intrinsically motivated by their oath to put their patients' best interests above the bottom line of the organization. Rather, they often, and I think that Marvin asked about compensation models. I think it's important to understand how you're paid. And, you know, doctors and medical students are kind of shamed into, you know, this idea that you shouldn't ask about how you're paid. But these convoluted models to reward productivity and to pay doctors based on how they are reimbursed by insurance companies or by how many patients they can see in a given amount of time or what procedures and investigations they do. These are all ways to make doctors to sort of perpetuate the fantasy that they are business people and that they're somehow their productivity ties into the financial success of the organization. And so that's often what's feeding into the conversations that happen in these medical groups now in hospitals. And so one of the ways that physician unions, and the reason that they're different from these medical societies, is there's an implicit threat of disrupting the business model of these organizations by withdrawing labor, either with a billing strike like I described before, or walking out. using the moral credibility that doctors have to shame and influence the policy of the organization. Yeah, I'll move on.
Yeah, I do want to remind my interns, the floor is yours every time. I do have a sets of questions that I'm happy to ask, but if stuff comes up that you're interested about, please raise your hand and I'll select you. So I'll give everyone a couple seconds. All right, the floor is yours, E.
Thanks, Zach. Damien, I'd love to hear more about the process of withholding billing and signing notes, and where have you experienced that? How did it go? Yeah.
Yeah, I certainly, if I do that, then I'll get fired. But the point is, if all of my coworkers do that, because we have built up over time a sense of solidarity and community and trust, enough that I'll know that the doctor in the next hospital or in a different department is doing the same thing I'm doing invisibly. Well, that will be quite an accomplishment, but we're nowhere near that. And that's partly why physically walking out of a hospital or a clinic requires a slightly less degree of solidarity, but it still requires a huge amount. And I think it's really important to understand that the kind of indoctrination that you guys are experiencing now as medical students, and that ramps up as residents, that you are in these steep hierarchies, you have to just keep your head down, and even the discouragement to like socialize and see yourselves as having like shared interests with your patients and with other health workers like nurses. Those are all deliberate attempts by kind of labor relations and anti-organizing experts in these corporate organizations to dissuade you from organizing and standing up for yourself. So the billing strikes, there's not a whole lot of history in the United States of billing strikes. There was one in New Jersey in the 90s that was more because doctors were not happy with the reimbursement rates they were getting from insurance companies. In Canada, when they were introducing their national health service state by state, there were some threats of billing strikes. But with the HITECH Act of 2015, everyone has an electronic health record, and in New Zealand and Australia that wasn't the case, because frankly the technology isn't very good, as you may have noticed. So there aren't that many examples that I'm aware of. If anyone else knows of any, please put it in the chat. I think that's a really important potential tool in the future, but I haven't seen it used or am aware of it being used in a successful way. But it's mainly because we're so disorganized and we don't have solidarity and we're not in communication with each other and we don't trust each other. So that's really the root of any kind of organizing. And that's kind of where these professional societies also, if they could be a positive force for change, but there's just a lot of headwinds and deliberate attempts to create these steep hierarchies and distrust, partly down to these compensation models.
And then Natalia.
Yeah, my question had to do with like union busting consulting groups coming in when people are trying to unionize, and what kind of tactics and arguments they're using. I know they do like a lot of like quote unquote education with people about, I guess, why they shouldn't unionize, but I'm wondering like what are they saying in those situations and what other tactics do they use?
Yeah, I think I can answer this well. We started organizing about 3 years ago, and once our company figured out, they did exactly what you said. They hired a huge union busting company. So Marisa was, of course, working with our campaign at this time and has more experience. But what the tactics they use is they want to convince you that unionizing will actually make your life worse, and that you kind of don't need a union. And so this is like something that you'll hear a lot is like, you don't actually need a union, like you can make change other ways. And so what they try to do is that, like, lawyers from a union busting company are never going to talk to you directly. They're going to talk to your managers and people that a lot of people feel like, oh, a lot of people like their managers, you know, like they like who like their lead physician is because they like work by them in their clinic, or they like their clinic manager or whatever. So they're going to talk to these managers and get these managers to talk to people and get these managers to send emails. And what the emails are going to say is like, what they did say is like, hey, we made some mistakes in the past, like there's been some missteps, but we're a big family and let's not bring a union into this because we can fix this together. We're all going to work together to fix this. And like what they'll even do is, like, our CEO started having all these meetings where like she invited a bunch of like rank and file doctors to these meetings and been like, I'm sorry, you know, but let's fix this together and we can all work together. And so it's like, you don't need a union. Like, we already have this big family. And of course, like, once we won our union, once we successfully unionized, all that went away. We didn't hear any more about that. That's all gone now. It's no more let's work together as a family. So it's BS. And, you know, everyone knows it's BS. There's no, you know, it's obvious, but it's like, that's what they're going to try. And then they're going to say like, oh, a union, like they're going to make your life worse. Like they're going to say the union is going to come in and they're going to decide your schedules for you, and you won't be able to pick up your kids from school anymore because the union's going to force you to have these hours, and you won't get the vacation you want. And what they're saying is basically like, can a union, first of all, I am a worker. I'm a doctor. I'm the union. Like, my colleagues and I are the union. Like, there's no like union that comes in and is like, this is what you do. A union is a group of workers that is bargaining together, is bargaining for what they think is important in their contract. And so what they're going to try to say is like, things could get worse. And it's like, is that true? Yeah, if you like decide to make things worse, like it could be, but of course you would never do that. And that's not what we would do, of course. But like, they're going to use like, theoretically a union could make things worse, which is like technically true, but obviously you and your colleagues would never do that. So it's like, those are the two big themes I would say, is like, your life is going to get worse, and actually a union won't do anything because like we don't need a union here.
So I want to say I agree with everything that Matt has said, and I know that all of it is from lived experience. I want to add that employers, I know I said this already, but I really want to make it so clear. Employers really, really want to see these efforts fail. Like, they will say and do just about anything to make efforts like this fail. And when it seems like you're really starting to get momentum and power, they'll double down and go extra hard. Like, just as an example, Matt's group just announced a strike authorization vote. 90% of his colleagues said that they would be willing to strike. And so the employer, one of the ways that they're trying to break the power of these doctors that have said it makes more sense for us to stand together here, they are telling their medical assistants, the executives are telling the medical assistants that if the doctors go on strike, they're not going to get paid. The medical assistants won't get paid, and it will be the fault of the greedy doctors for withholding pay from other workers that are already making way less money than a doctor does, probably less than someone working at the gas station across the street does, actually. And I think that, you know, dividing and conquering is a really common tactic that employers use to try to break any sort of like feelings of collectivism or solidarity. And so here the division is pitting the medical assistants against the doctors who are trying to organize. And back in actually in 2020, I organized a strike with doctors out in Washington State, and the employer used the exact same tactic, to the extent that they actually had the MAs come and the nurses come and approach the doctors and say, please don't strike, because if you strike, we're not going to get paid. We can't afford that. And the truth is, like, it's entirely the decision of the employer to do basically anything here, right? Like, if they decided not to pay the medical assistants, that would be on the employer. That would be their choice. That's a strategic and tactical choice to make it more difficult for the people who are trying to organize to stay organized. That is their choice. It is not the fault of the doctors. But to the people who aren't going to get paid, it probably feels an awful lot like the fault of the doctors. And so sometimes I'll hear employers at the beginning of a union organizing drive, try to, leverage those relationships in the same way. Or they'll go to one subset of doctors, maybe really highly paid specialists, and they'll tell them, if your colleagues unionize, we know that you're a cardiac surgeon, but you're actually going to be brought down and paid the same as a hospitalist. And then people are like, oh my gosh, I want everyone to do well, but I don't want to lose all of this money. I don't want everyone to get paid the same as me. And so that sort of misinformation, or like the pitting the different groups against each other, or making it clear that for you to succeed, other people have to suffer. I think that that is really common to what I hear when I see employers start to, build strategy around busting unions. And then the last thing I'll say is I think that there's like a sense of moral righteousness and fear that employers also try to instill into anti-union drives. With this group in Ohio, when they fired the two doctors, it was really because they accessed an employee directory to look for phone numbers for people to reach out to talk to about the union and about other workplace changes, right? Like, I bet that you use a directory because you're like, let's set up, a happy hour or something. It's just, that's what a directory is for. It's for talking about patient care, but there's also like a social and community aspect of being a worker as well. But the kind of moral high grounding that the employer did was they talked about the doctors having stolen proprietary information. They made the issue a different issue. It wasn't about them organizing for forming a union. They stole information that should have been protected and that should have belonged to the doctors. And like, how dare they do that? It was that kind of like moral grandstanding, I think, that actually made some of their colleagues question maybe they did do the wrong thing, and maybe kind of having these conversations is the wrong thing to do. With Matt's group back a couple years ago, when they were trying to organize, the employer created flyers that insinuated that the physician organizers that were looking for people to sign union authorization cards were going to take the authorization cards and sell people's personal information. Like, psycho. That would never happen. But it's that sort of like, well, they might do the wrong thing, the shady thing. It's just that little bit of fear that lingers that I think makes people think twice. And honestly, a lot of people bought into that. A lot of people were like, what are you going to do with my home address? It's like, well, it's already on white pages. There's nothing that we can't find. But it is scary to hear that from an employer.
Yeah, I just wanted to also add my thoughts about that. Something I think a lot about, and I've experienced a lot of in various different forums. There's carrots and sticks, and doctors are particularly vulnerable to the carrots, meaning that one of the principles of organizing is leader identification. So finding the person in your workplace or even in your student group who is the person that others look up to, person who gets the birthday cards or who organizes the social gathering. Well, if you want to have a successful organizing drive, you have to figure out who those people are and make sure that they're on your side. And the employer understands this principle better than most of us do. So the employer identifies that person and offers them something, a special deal on the side. So in the case of physicians, that can be more non-clinical time, or you can pursue the project that you're interested in. Or even with our compensation models, there's many opportunities for a bonus here, or some added, a better payer mix, or various subtle ways of changing and rewarding someone for their loyalty. And you see that a whole lot in my workplace and with my union. And that has sort of gone on and undermined our ability to work together, because those special perks that aren't written down anywhere are under threat, or at least that's the implication by management for these doctors who have these special perks. And it also appeals to our kind of professional privilege sense of, we deserve this special thing because I went to Harvard and I did this or that. Doctors are very vulnerable to that notion that you are special and better than and deserving. So that's a carrot. A stick, one that is unique. I think it's common throughout the United States, but especially where I work, it's a lot of immigrants, and they require their employer to renew their visas. I don't have the numbers. My union is reluctant to collect this data, maybe for good reason, but um, many, if not most, of my coworkers are on visas, and the employer threatens those workers with not renewing their visas as if it's a privilege for them to renew their visas. And that is a fantastic way to extinguish any desire to act collectively or to put your head above the parapet, whether it's about standing up for your contract or even pointing out poor patient care. So that's a really noxious and very common in the United States. There's the residents in the hospitalist residents at Elmhurst. Every one of them is on a visa, and I think that's very common in medical training throughout the United States to have immigrant doctors, and especially with what's happening now in the United States. That just makes immigrant doctors even more susceptible to exploitation. And the union busters understand that, and they use that to their advantage to create division and fear and hopelessness.
All right, and I'll open it to the students, and then I'll have one question, and then Dr. Malik, you'll be after that. Anana?
Hi guys. Sorry my camera is off. My internet's just a little bit stable and I keep freezing up. But I don't know if this was addressed, but have you guys noticed when recruiting for unions, if you find that it's more difficult for specialists to join them than primary care field doctors?
I can speak a little bit to this. So I just did a pretty big union election last year for a group that had maybe like 61 specialties. It's about 500 doctors across 4 hospitals. I would say yes. Like it is at times difficult when you have so many different specialties. I think that it's difficult at times for people to get aligned on what they want and how they want to get there. And employer messaging, trying to create division between the specialties works pretty well. I think that one question that people ask all the time when we're doing drives like that one is like, how can a single union possibly represent all of our different needs, like being as diverse as they are? And I think that part of getting people past that is understanding that like on paper it might seem like the issues that people face are really different, but they're actually really not all that different when it boils down to it. Like it's dignity, it's fair, getting paid fairly, it's having a voice in patient care. And when it comes to the specifics, like you really can negotiate pretty specifically so long as the rest of your colleagues are willing to have your back. Primary care drives tend to be a little bit easier. Just, I don't want to say easier, but I find getting people on the same page messaging wise is easier just because there's a lot of commonality in what people are experiencing at work, and the differences tend to be geography based more than specialty based. For Matt's group, for example, depending on where your clinic physically was in the Twin Cities, you might have a different work experience. In fact, there were many clinics that were in kind of wealthier neighborhoods. They had a totally different experience than the more rural or poorer areas. And so, that was something that sort of made it difficult to get people aligned. The people in the richer areas were like, it's already pretty great. I don't know why I would want to change any of it or rock the boat. But ultimately, there was kind of like common threads to organize around by virtue of it being primary care. I think that there tends to be a belief that like the really, really highly paid surgeons or anesthesiologists like Damien is, or whatever other specialties, like they're never going to get on board. They make too much, they're too powerful. But I've actually found the opposite to be true. Even even if maybe like their main issue isn't the same issue as someone doing primary care, there might be something else there. I remember working with a trauma surgeon a few years ago, and his issue wasn't really about money in the way that you would expect, but it was about having his money tied to the amount of procedures that he was doing. And this actually happened recently with a transplant surgeon I was working with too. Both of them felt like, I don't really want my patient care decisions or the way I get paid for them or the way that I'm viewed as a doctor to be tied to the number of procedures that I'm doing. Like as a trauma surgeon, you can't make more people need trauma surgeries. And the transplant surgeon was like, I don't want to be just, taking out any liver for the hell of it. Like I want to make sure that I'm doing the right thing. So yeah, I guess to answer your question really directly, it can be harder. It all comes down to like getting deep enough into the issues and finding out what people really care about. And oftentimes there's something there.
Thank you.
And I'd be really interested, actually, Damien, if you have thoughts about that being one of the specialties. In my experience, you guys are really hard to organize. I wonder what your thoughts are.
Me too. Yeah, no. And I've given you a little bit of insight into my background. I did my medical school and my residency in New Zealand. I also worked for Doctors Without Borders and have worked in different conflict zones and have done humanitarian work. And then I also worked at one of the more exclusive hospitals on the Upper East Side of Manhattan called the Hospital for Special Surgery, where they take care of professional sports players and Saudi royals. And then I went to Elmhurst Hospital in Queens, which was the epicenter of the epicenter in 2020, and we had 200 patients on ventilators. It was horrifying. It was awful, and that was a real. So that gave me a unique insight into American health disparities. And then I got leukemia when I was just a few months out in kind of summer 2020, and I had the patient experience, and I had to navigate health insurance and job security, and then realize that I was a member of a union, and why isn't this union helping me? And so that sort of put me onto this track, and trying to get my coworkers, anesthesiologists, to focus on specific issues and act collectively. Yeah, they're very afraid. They have a lot to lose, and they often have enormous debt, often in the 200,000 to 300,000 category when they finish. And the business model for the employment of doctors at my hospital seems to be find new grad residents, burn them out with very long hours, 80-hour weeks sometimes as attending physicians, and then they quit after a few years and go and work at Mount Sinai or in the private system. And so their attitude in those first few years is, I'm just going to keep my head down like they've been trained to do as residents. And that sort of keeps the gravy train going. So that's not only anesthesiologists, but I think especially anesthesiologists have a lot to win and a lot to gain by just not making waves or ruffling feathers, but also a lot to lose. But I think many of them do perceive the injustices and the inefficiencies and the steep hierarchies that lead patients to harm. And I think, the reason that there's so much burnout, there was a recent report from the AMA asking about specialties that are looking to leave medicine, and anesthesiologists were the highest. So something like 40% of anesthesiologists are seriously considering leaving medicine in the next 2 years. So anesthesiologists bear witness to a lot of the corporate practices of medicine, which encourage questionably necessary surgery, corporate practices that treat the operating room more like an assembly line than a place that patients, need to get patient-centered care. So I'm sort of a little bit optimistic about the future, but yeah, in the current moment, it is hard to get anesthesiologists or other specialists involved in acting collectively.
And then Dr. Hoffman, if you don't have anything to say, I'll get into my next question.
Yeah, I'm a
But
primary care union, so I'll let Marisa and Damien hit that.
um, so this next question goes into it kind of seems like solidarity among not only physicians, but the hospital staff as a whole, something that is a barrier to unionizing. So I'm interested in what conversations you think we can have with our peers as medical students to kind of maybe lay a more solid groundwork than maybe your generation of physicians had in terms of viewing ourselves as labor. And it seemed, even especially the people here, we're all aware that there's problems and we don't know how to address them. And part of the reason we joined this was, we're so overwhelmed and we want to be doctors to help people, and people are telling us you can't do that anymore. So maybe if you have any ideas of what we could do to kind of start building that solidarity, or yeah, I'll leave it there.
I love that question. If I could have like planted you here to have you ask that question, I would have. I love it. I think that's like exactly the right question to ask. And it's like not just medical students. I think like I find myself in that situation. I think we all find ourselves in that situation. Just like for some background, like this country, has seemingly lost a sense of labor. Like our political alignment is not among labor. There's no talk of real labor in terms of like our politics. And so I think like it's a hard thing like to like rebuild that, but I think like we absolutely do have to rebuild that. And I think that doctors in particular, and maybe a lot of professionals, they don't always think of themselves as workers. They think of themselves as like, hey, I'm kind of in charge or I'm kind of running the show. And it's like, no, that's not the case. And maybe that was in the past, but by and large, that is not the case anymore. Doctors in their workplaces do not have very much power. And so we are workers. We're workers just like nurses. We're workers just like any other worker in a hospital or clinic. And so I think that like to answer your question, like what can you do right now is like, I know it sounds like boring and like whatever, but it's like talking to your colleagues, talking to other medical students like right now about like, hey, these are the struggles in medicine. And the answer to that is we have to work together. We have to take power into our own hands, and that we are not going to be like in charge when we enter the workplace. We're not, certainly I can be in charge as a resident, but even after a resident, you're not going to be like in charge. And so you have to work together with each other. Like you have to organize together. And I think trying to help other people understand like what your position is in this world as a doctor is you are a worker. Like you are employed almost always now, and that like you are going to have to work together to fight back against the system to make change. And I think you can do that in a lot of ways, but a very important way is to unionize, is to work together as a union where you actually have leverage to make changes within your environment. So, um, you know, I think what that looks like realistically is like the first thing is when you talk to one of your fellow students, like asking them about their experience or what they think of medicine, and like trying to find some common ground in terms of like what do they care about. And it's like I know you all care very deeply. It's like when I was a medical student, I probably wouldn't have done what you were doing now. So like I know you're busy, and taking the time to do these things like is really great. I suppose you're like out summer break of some kind now, maybe some of you. But it's like really taking the time to talk to your colleagues is always the most important thing you can do. I mean, that's what organizing is. It's one-on-one conversations with your colleagues, and that's irreplaceable. Like there's no like giving people a book to read, or I don't know, having them watch a lecture or something. Like the actual work of talking to your colleagues, like that is always what you have to do at every stage of your life to organize. So it's like start it now, start forming connections, start forming relationships, and trying to get people on the same page of being ready to fight together is I think what you should all be doing.
Yeah, I love that question too, Zach. And I still don't, I have notions, but I struggle to put it in practice. But there are well-worn grooves to pit you as a new intern or even a medical student against each other and against nurses, and trying to resist and at least perceive that kind of divide and conquer tactic, and take that lifelong learner mentality that you should be developing as a medical student, and extend that to talking to nurses or to nursing students or to people who clean the floors in whatever clinic, and ask them about the who employs them and how's that going, and are they understaffed, and maybe you can make some connections between your own scheduling and roster challenges with them and have a connection about that with them. So that's one practical idea. I know, telling people to read lots of books isn't necessarily helpful, but I'm just putting in the chat Jane McAlevy's No Shortcuts. The title of the book is a good reminder that, like, you just got to build up this human connection with the people around you. And, it sort of gets beaten out of you in medical school and residency to just be a human being and be curious about the people around you. But that's the fundamental basis of a fighting militant union, or your ability to stand up for your coworker who's unfairly retaliated against. But it also means that you're a better doctor. And if you have solidarity not only with your coworkers, but also with your patients, that's basically just empathy. And it means that it's something that it's a good skill to develop as a medical student, to not let that curiosity and genuine desire to have a human connection be beaten out of you.
I think Damien's exactly right. The only thing that I'll add is there's a question that I remember when I told Matt that he should ask the question in his organizing conversations. He was like, "Why did you wait so long to tell me?" It's really simple, actually. It's basically when you're asking people about their working conditions or work or really anything at all, just ask them, how does this impact you when you're not at work? I think that's like a really big question that people forget to ask.
All right, and then Dr. Malik.
Yeah, did you, any of the interns want to ask a question before I go? Okay. In that case, I wanted to ask a sort of bigger question. So it seems to me that a union could, at the most basic level, fight for better salary, adequate health insurance coverage, pension, the usual things. And it seems to me there's like higher levels of what a union could do. And I'm wondering what your visions are of what you think should be done. The second level might be, so for example, back during the Cretaceous era, I was a member of Committee for Interns and Residents, a union. And they had just finished a negotiation for a strike. They had been on strike over nursing staffing levels. They felt that the care at the hospital was unsafe because there simply were not enough nurses. The nurse to patient ratio was just ridiculous. Okay, so that improved. So that's sort of a second level, the actual conditions you're working in to be able to actually provide halfway decent patient care. Then a third level, I think Damien, mentioned, which was, this isn't really related directly to my work, but your union apparently acted to stop the hospital from going after patients who couldn't pay their bill. And the hospital deployed credit, people to bill collectors who were using nasty techniques, even saying a patient could never get care in that hospital ever again if they didn't pay their bill. So it's not directly related to your salary or working conditions, but it's how the hospital's doing things, and you don't like it, so you could act to change it. Okay, so then there's a fourth level. You could say, well, actually, the whole healthcare system's kind of screwed up, and everybody should have adequate health insurance. I'm, say supporting single payer health reform. So that's kind of another level. And then just to take it to a fifth higher level, you could say that, well, actually, the whole country's in a fairly acute trouble. Like, we've now left the Reagan era of kind of friendly neoliberalism. We were all nice to each other, but we're going to privatize everything and, kind of cut benefits, to a different regime. The oxygen is still 21% of the atmosphere and nitrogen still 78%, but we're in a new era. We now have a government that really, who's using emergency declarations, intimidating the legislature and Congress, a completely genuflecting Supreme Court, fiat, just whatever tariff I feel like today we're going to have. I'm going to go after Harvard. I'm going to just screw everyone, take away the governmental support. Anybody who opposes me, I'm going to find a way to screw them. So we're moving toward autocracy pretty quickly. And I think we need social institutions that are going to fight that. And, organizations like Public Citizen is not going to be enough. We need every single organization there is. And historically, the union movement has been part of this. And I'm just wondering whether you think even that level isn't a level where unions could or should be active right now. And I say this in the setting of physicians working really long hours, even at best. So it's hard for them to take on all these struggles. I'm just wondering what your thoughts are on all that.
Yeah, I think like from a big level, I don't like I'm not just in this to unionize doctors. Like I think everybody should unionize. Like the battle lines in this country, like if the battle lines in this country are between Democrats or Republicans, like I don't think we're seeing single payer healthcare. It's like I think need we need to have a real labor movement. Like we need to have workers that actually have a say, and that's not where we are in this country right now. And so I think behind the reason I want to unionize, it's not just like it's not about like, okay, can we get paid a little bit more? Can we have this hours change? It's like we need to put the power back in hands of workers, back in the hands of labor. And that's that's not just in medicine, that's in institutions across the country. And I think unless we do that, we're not going to have those voices that are heard on a national level. It's like this is our way to advocate for ourselves, is taking power back through our work. And it was actually my group that as you mentioned, like got that policy canceled about patients in debt. I mean, it was dreadful. And it's like, yes, that is through a union that we work to do that. And so it's like you do have those things you can do as a union, but it's like we need to redefine like what are the battle lines in this country, and we need to actually have real advocates for working people, for labor. And it's like if I were, I don't know, if I were working in the post office, I'd be active in the postal union. But it's like if you're in medicine, you should be active in a medical union, because that is the way to really redefine where is the power in this country. We don't have power in the hands of workers at any level, and we need to get that back. I mean, that's when we're going to see change. That's when, who cares about healthcare, right? Is it bosses? Is it, no, it's not. It's workers. So it's like workers need to have a voice to change that in the country. And I want to respect your guys' time. I think this ends at 9:30, so I don't want to talk too long. And I'm sure Damien has good things to say too.
Yeah, I'm sure this is a topic every one of us and our family and our coworkers is thinking about a lot. Again, it comes back to power. And yeah, like Matt said, we are very powerless alone, but together, if we're organized, we can stop this rising authoritarianism. And doctors have a unique place. I think healthcare has a unique place. It's about 20% of the economy, and it's the largest single employment sector. And doctors are leaders of healthcare workers. We do have a respected voice. So I think there's a lot of potential. When it comes to concrete visions, well, New York City has the largest public hospital system in the country, and it has suffered from neoliberal reforms for decades, being cored out and privatized and deregulated and sold off. But there is a new mayor. There's also a very sympathetic city council. And I love the idea of leveraging CIR and NISNA and 1199 and Doctors Council and patients to insist on a remunicipalization of New York City healthcare. And maybe that's a little pie in the sky, but unless it happens, and unless healthcare workers organize on a massive level, I feel pretty pessimistic about where things are headed. And there are, the simple issues like pay and benefits, but I think issues that will come to a head are, say, ICE raids on hospitals. Is that a good way to finally get doctors and nurses and other healthcare workers to see that their interests align with their patients and that they need to organize to stand up for their patients? But I'd love to hear your ideas, and I put my contact details in the chat. Please do reach out if you have thoughts, because it's a big topic and it's important right now.